Hello friend, I hope everyone is well. Before going to the main discussion, I will say that those who are new to my channel must subscribe by clicking the bell button next to it so that you can watch all my next videos. Thanks to those who have subscribed. So friend, let's start the discussion today. Today's topic is sexual dysfunction, its treatment and solution. We will know now, what is sexual dysfunction? Sexual dysfunction refers to a problem occurring during any phase of the sexual response cycle that prevents the individual or couple from experiencing satisfaction from the sexual activity. The sexual response cycle traditionally includes excitement, plateau, orgasm, and resolution. Desire and arousal are both part of the excitement phase of the sexual response. While research suggests that sexual dysfunction is common, 43% of women and 31% of men report some degree of difficulty. It is a topic that many people are hesitant to discuss. Because treatment options are available, it is important to share your concerns with your partner and healthcare provider. We will know now what are the types of sexual dysfunction. Sexual dysfunction generally is classified into 4 categories. Desire disorders, lack of sexual desire or interest in sex. Arousal disorders, inability to become physically aroused or excited during sexual activity. Orgasm disorders, delay or absence of orgasm. Climax, pain disorders, pain during intercourse. Hello friend, we will know now. Who is affected by sexual dysfunction? Sexual dysfunction can affect any age, although it is more common in those over 40 because it is often related to a decline in health associated with aging. What are the symptoms of sexual dysfunction? In men, inability to achieve or maintain an erection suitable for intercourse, erectile dysfunction, absent or delayed ejaculation despite adequate sexual stimulation, retarded ejaculation, inability to control the timing of ejaculation, early or premature ejaculation in women. Inability to achieve orgasm, inadequate vaginal lubrication before and during intercourse, inability to relax the vaginal muscles enough to allow intercourse in men and women. Lack of interest in or desire for sex, inability to become aroused, pain with intercourse. We will know now, what causes sexual dysfunction? Physical causes. Many physical and or medical conditions can cause problems with sexual function. These conditions include diabetes, heart and vascular, blood vessel disease, neurological disorders, hormonal imbalances, chronic diseases such as kidney or liver failure, and alcoholism and drug abuse. In addition, the side effects of some medications, including some antidepressant drugs, can affect sexual function. Psychological causes. These include work-related stress and anxiety, concern about sexual performance, marital or relationship problems, depression, feelings of guilt, concerns about body image, and the effects of a past sexual trauma. How is sexual dysfunction diagnosed? In most cases, the individual recognizes that there is a problem interfering with his or her enjoyment, or the partner's enjoyment, of a sexual relationship. The clinician likely will begin with a complete history of symptoms and a physical. He or she may order diagnostic tests to rule out any medical problems that may be contributing to the dysfunction. If needed, typically, lab testing plays a very limited role in the diagnosis of sexual dysfunction. An evaluation of the person's attitudes about sex, as well as other possible contributing factors, fear, anxiety, past sexual trauma, abuse, relationship concerns, medications, alcohol or drug abuse, etc., will help the clinician understand the underlying cause of the problem, and will help him or her make recommendations for appropriate treatment. We will know now how is sexual dysfunction diagnosed. In most cases, the individual recognizes that there is a problem interfering with his or her enjoyment, or the partner's enjoyment, of a sexual relationship. The clinician likely will begin with a complete history of symptoms and a physical. He or she may order diagnostic tests to rule out any medical problems that may be contributing to the dysfunction. If needed, typically, lab testing plays a very limited role in the diagnosis of sexual dysfunction. An evaluation of the person's attitudes about sex, as well as other possible contributing factors: fear, anxiety, past sexual trauma, abuse, relationship concerns, medications, alcohol or drug abuse, etc., will help the clinician understand the underlying cause of the problem, and will help him or her make recommendations for appropriate treatment. We will know now. How is sexual dysfunction treated? Most types of sexual dysfunction can be corrected by treating the underlying physical or psychological problems. Other treatment strategies include medication. When a medication is the cause of the dysfunction, a change in the medication may help. Men and women with hormone deficiencies may benefit from hormone shots, pills, or creams. For men, drugs, including sildenafil, Viagra, tadalafil, Cialis, vardenafil, Levitra, Staxin, and Evanafil, Stendra, may help improve sexual function by increasing blood flow to the penis. Mechanical aids such as vacuum devices and penile implants may help men with erectile dysfunction, the inability to achieve or maintain an erection. A vacuum device, Eros, is also approved for use in women, but can be costly. Dilators may help women who experience narrowing of the vagina. Sex therapy. Sex therapists can be very helpful to couples experiencing a sexual problem that cannot be addressed by their primary clinician. Therapists are often good marital counselors, as well. For the couple who wants to begin enjoying their sexual relationship, it is well worth the time and effort to work with a trained professional. Behavioral treatments. These involve various techniques, including insights into harmful behaviors in the relationship, or techniques such as self-stimulation for treatment of problems with arousal and/or orgasm. Psychotherapy. Therapy with a trained counselor can help a person address sexual trauma from the past. Feelings of anxiety, fear, or guilt, and poor body image, all of which may have an impact on current sexual function. Education and communication. Education about sex and sexual behaviors and responses may help an individual overcome his or her anxieties about sexual function. Open dialogue with your partner about your needs and concerns also helps to overcome many barriers to a healthy sex life. Friends, we all know now. Can sexual dysfunction be cured? The success of treatment for sexual dysfunction depends on the underlying cause of the problem. The outlook is good for dysfunction that is related to a condition that can be treated or reversed. Mild dysfunction that is related to stress, fear, or anxiety often can be successfully treated with counseling, education, and improved communication between partners. So friend, today I will talk again about the next topic. Before leaving, I will say that those who have not subscribed to my channel must do so. Thank you.